We have with us today Dr. Ayodeji Bakare. He's an OBGYN specialist. He has his practice in Harrisburg, Pennsylvania. He's been in practice now for about 26 years, a very large practice. He's going to be educating viewers on some of the common illnesses in the field of obstetrics and gynecology. Nice to have you, sir.
Thank you. Thanks for having me.
Dr. Bakare, can you tell us what are the common illnesses that that we see in females in general, or in the field of gynecology and obstetrics?
Well, generally we deal with different kind of ailments that afflict women, but our practice is sort of divided into two big groups. Preventive health care for women and acute health care for women. And the preventive health care is what most people are already familiar with. We do preventive health for cervical cancer, which most people recognize as pap smear screening.
Okay.
Cervical cancer in the 1950s was a very devastating disease. It used to kill about 45,000 women a year in the United States. But since we started doing pap smears, we've been able to decrease that death toll to under 4,000. And what pap smears do is actually help to pick up changes in the cervix that, if not treated in 5 to 10 years, could lead to cervical cancer. But with the screening, when you identify these changes, you are actually able to get rid of the changes, return the cervix to normal, and hence prevent the women from actually getting cancer of the cervix. And it's one of the most successful screening tools in medicine. The other preventive thing that we do is breast exam and mammograms for women. Again, breast cancer is another major killer of women. Even now, breast cancer still kills about 45,000 women a year, which, to put it in perspective, 58,000 men and women died in the Vietnam War over a period of 10 years. And if you average that out, that's about 5,800 people died per year in the Vietnam War. And yet we're talking about a disease that kills almost 10 times as much in 1 year. So breast cancer is actually like a Vietnam War every year.
Wow.
As opposed to 10 years. The screening for breast cancer has not been as successful as that of pap smear, because we're still not able to prevent breast cancer. The success of breast cancer screening is to help identify the earliest stages of breast cancer and therefore be able to treat it and decrease the death toll. So we're making an impact in women who have advanced stage disease, but we're still picking up as many early cancers as we did 10 years ago. But mammogram is the best shot at preserving life, because if you can identify breast cancer early, you can decrease the death rate for breast cancer.
And is there any role in women doing self-examination? Can that help in any way?
Well, we still encourage women to do breast self-exam. Not so much because it significantly helps in decreasing death rate, because most studies now conclude that it really doesn't decrease death rate. But what we find is it's a motivational tool. Women who do breast self-exam are more likely to respond to other health initiatives. They're more responsive to their body. They are more likely to be more compliant with recommendations that their healthcare provider makes. So from that standpoint, it's still of great value to encourage women to do breast self-exam. In today's medical practice, gynecologists also function to a large extent as primary care physicians for women. So we do address cardiovascular health. We want to know how women are doing regarding their cholesterol levels, their smoking habits, things that can impact their cardiovascular health. We encourage women in terms of nutrition in general, weight loss strategies. These are things we now do as managing the overall health of the women. And for patients who are older than 50, very frequently we're also the providers that would initiate these women getting their colonoscopy to prevent and address colon cancer. So that's mostly how we impact the health of women on the preventive side. In terms of the acute care, when women get sick, ailments range from very minor things like vaginal infections, like yeast infections, what we call bacterial vaginosis, which is a mixed type of vaginal infections that women get. And it keeps us busy because we see these infections frequently. The most other common things that we deal with are bleeding issues. Women who have irregular menstrual periods of different types. Sometimes this irregular bleeding may be very benign, mostly because women have hormone imbalance of different issues, of different types. But sometimes it can be a sign of significant disease, significant pathology. Most of them, when it's significant, it can be the first sign of a significant tumor of the reproductive tract, either cervix or the main body of the uterus itself. The most common things that we deal with is a type of pathology that's called fibroids. Women, you generally see fibroids in women 35 years and older. And the most common presenting symptom is heavy and sometimes irregular vaginal bleeding. So bleeding is one of the most common symptoms that we deal with in gynecology. We also deal with a lot of pain. Okay. Women have pelvic pain that comes from different causes. It could be pain related to something going on with the ovaries. It could be pain going on with something to do with the uterus. But the most common cause of pelvic pain in the reproductive years is endometriosis. Endometriosis is a very common pathology in women, especially women, I would say mid-20s to mid-40s. It's about the age group where we see this, and the most common presenting symptom is pain of the pelvis, that's frequently worse at the time of menstruation.
And what's endometriosis?
Endometriosis is a condition that women have that's due to abnormal transplantation of the cells that are naturally supposed only to be in the lining of the uterus, which is called the endometrial lining. Because when a woman menstruates, most of the flow is to the outside, but some of the flow is actually retrograde. It goes back through the fallopian tubes and into the woman's peritoneal cavity. And the theory is that some of these cells from the lining of the uterus are transplanted from where they naturally should be to the inside of the woman, which is not their natural position. But these cells then implant on the surface of the peritoneum and begin to grow.
And then they cause pain.
They cause pain.
Much more than if it was in the uterus.
They cause pimple-like growths all over the pelvis. It can grow on the ovaries, it can grow on the fallopian tubes, it can grow on the surface of the uterus, it can grow on the surface of the intestine, on the surface of the bladder. It can grow anywhere in the peritoneal cavity.
How devastating can this kind of pain be?
It can be very debilitating. So many women have to take off work around the time of their periods because of how severe the pain is. Unfortunately, the degree of pain sometimes has nothing to do with how bad the endometriosis is. You can have very mild endometriosis. In fact, there's a staging system that has been developed to help doctors and providers identify how significant the endometriosis is. And it goes from stage 1 to stage 4. But the staging is not sometimes related to the degree of pain, because other things come into play vis-a-vis the natural pain threshold of the particular woman. So you can see a woman with a stage 3 disease with minimal pain. You can see another woman with a stage 1 disease with severe pain. Yes.
When we come back, I'm going to be trying to get into some of the areas that that women, a lot of women complain about a lot, the issue of infertility. A lot of women that have been trying to get pregnant and they're struggling with that issue. It's very common all over the world. We'd like you to educate our viewers about that area. Thank you very much.